And with the new Ebola infection of that Dallas nurse, we wanted to know a little more about what the CDC calls the two high-risk procedures for spreading the disease. KXAN's Phil Prazen takes a closer look now.
Anytime a healthcare provider works around bodily fluids of someone with Ebola, the risk for contamination is there.
Yeah, any orifice, your mouth, your nose, your eyes, wherever blood can come out from.
According to the Centers for Disease Control, there are two high-risk procedures. The first is inserting and taking out a breathing tube. The second is kidney dialysis, or connecting the patient to a machine via IVs and tubing that cleans the blood.
I think it's showing us where we are and where we are not prepared for an outbreak like this.
Catherine Troisi with the University of Texas School of Public Health in Houston says the virus survives a few hours as the bodily fluid dries, but if it stays in liquid form, it can stay active for days. Most diseases do not require protective gear. Fewer than half of Ebola patients hemorrhage bodily fluid, but still, this process is crucial.
Because your safety equipment may be contaminated on the outside, it's when you get out of it that you have to be particularly careful.
If it's done right, she says it should take about 15 minutes to put on and take off the protective clothing. And now with a second healthcare worker infected, it emphasizes every precaution is necessary. Phil Prazen, KXAN News.
Now at 5, we told you the FAA does not regulate how often planes are cleaned. Generally speaking, though, a deep clean happens every 30 days of service. But we've also learned where the biggest problem areas are on an airline. There's a 2-year study at Auburn University. It found tray tables had the highest levels of bacteria. Seatbelts, armrests, and toilet handles were also singled out as places where bacteria can survive. Researchers found one type of bacterium could last up to 168 hours, a week, on the back pocket of an airplane chair. They also pointed out even though bacteria doesn't last as long on hard plastic surfaces like armrests, they were the most efficient at transmitting it to the next set of hands.